This interview was recorded at the Psychedelic Science 2025 in Denver, where we spoke with leading voices in psychedelic research, therapy, spirituality, and policy. Dr. Brian D. Richards is a clinical psychologist working at the intersection of psychedelics and palliative care. His research explores how these substances can support patients with serious illness. In this interview, we talk about designing therapeutic spaces, selecting appropriate patients, and the future of end-of-life psychedelic care. So, Brian, how did your early experiences as a child growing up in the family with Bill Richards shape your interest in psychedelics and your career?
Thank you. So, growing up, my father was a clinical psychologist exploring these various medicines, dipropyltryptamine, LSD, at the Maryland Psychiatric Research Center. That research came to an end, and so at the time it came to an end, I was very young. But I did appreciate the idea of how medicines could be very helpful, and particularly this class of medicine, this psychedelic, what's now being increasingly termed experiential medicines. And when I became a clinical psychologist, graduate student, postdoctoral fellow, there was this opportunity at Johns Hopkins Behavioral Pharmacology Research Unit with Roland Griffith's team and with my father to really do some research. And this was really abuse liability of the medicines, what we would like to learn about them, dosing, and the scientific argument was there was an entire class of medicines, what we call psychedelics, that people worldwide are using, that we had some earlier research on, and research was done very differently decades ago. And we needed to do definitive, current, placebo control, rigorous science to better understand drugs that people are taking. And remarkably, Roland Griffiths and his team, which included me as a postdoc, was able to obtain permission to once again take a look at these psychedelic medicines, beginning with psilocybin. And that was the genesis point of the resumption of research and looking at healthy normal adults and then people who had a cancer diagnosis and how they respond to different doses of psilocybin and the set and setting, the therapy model. How can we as therapists be helpful to the person? How do we prepare them? How do we support them through what can be a crucible experience, a mystical experience or a disappointing, unremarkable experience, whatever it is for the person, and also then integrate that into their lives. And it's been very meaningful to be one of the people working on this as best I can, and really appreciate your interest as well in learning more about this.
So psychedelics cannot cure cancer, but how can psychedelics help people with serious illnesses?
One of the early takeaways of research that was done by Eric Kast in Chicago, where he had just administered LSD as a drug only with no support, was that many of those people found that they reported less pain, needed less pain medicine, less anxiolytic medicine, were more at peace, and some even reported that they no longer feared death. And that's pretty extraordinary, that there's any intervention we can do which in one day can occasion a experience within a person's own mind that is so profound and so compelling and meaningful that they no longer fear dying, and death is coming. It is inevitable. It is soon, as part of the progression of their cancer. And so that is also part of the mystery of life, that human beings, here we are, we don't know where we came from, and we don't know where we're going, but we can all agree we're sharing this human experience, which will inevitably, inescapably until death at some point, which typically we don't think that much about, or we're avoidant of, or we may fear, but it's often kind of something that will happen one day. for people who have a cancer diagnosis, it becomes very real, viscerally real, that death will come sooner for them than many others. And that can occasion tremendous fear, demoralization, depression, cynicism, nihilism, resentment, a deep unhappiness that this has happened to them, that life has given them cancer. So just that a person with this medicine can have an experience that is deep within their own mind, not something I offer as an interpretation. It happens experientially, and so that idea of an experiential medicine is really, there's something as a possibility there where something really shifts. And if I could offer maybe the narrative, having worked with many people with various forms of cancer, some of whom have died, some of whom had a positive outcome, early detection, minor surgical intervention, and no evidence of disease for many years. But everyone contends with that great fear of the unknown that eventually we will experience ourselves into when we leave our bodies, when we die, etc. What I was struck by was the extraordinary sense of peace that some people came to, and it could be a real ordeal to move through that fear, confront, contend with those feelings, those images, those memories, the experience with this psychedelic. But what some people would say to me is, it's like I remembered something I forgot. I always knew this on a deep level, that I'm more than my mind. I have a mind, I'm not my mind. I have a body, I'm not my body. And as what might be described as just a noetic understanding, not the intellect, but a deep realization or remembering of something they had forgotten. So when we think of spiritual experience and what does that mean, for some people who are contending with a cancer diagnosis, it's very clear that they've remembered, reconnected with the understanding that they're more than their body. And so their body will come and go, and there's a sense of knowing that consciousness will continue beyond the point of death. And consequently, for some, it's quite a natural discarding of the fear of death that is abiding, that is not a transient drug-related phenomenon. Drug is excreted in 24 hours. It's metabolized. The memory of that experience is something that continues for people, and then they really don't fear death. And we can also see that more objectively in how they, not only their mood improves, but their behavior in terms of connecting with family, the work they want to do, the things they want to say and experience before they die, but also a markedly diminished need for some of the medicines that they were using previously, which is really pretty remarkable. So there's this internal shift that is also wonderful for me to see as a provider. Like, we really do have some way of helping people with the great existential challenge we all face of the inevitability of death. And that's a wonderful gift. I mean, for all of us, if we could feel less fear, and not as an abstraction, but experientially, really not fear death, be at peace with that. For many people, they might quite naturally begin to live their lives very differently, less fear-based, and the present moment and what is, and what might I contribute or experience, and this will come and go. More of a sense of gratitude for the life that we have. And those are things that happen quite naturally for people once they've had a mystical type experience. It really can be transformative in that it helps people be more present and appreciate what life is giving them, even if it's hard. And also this infinite aspect of consciousness, which is, here we are now, and there will be many more experiences that lie ahead. but to appreciate this moment.
You know, in our society, the most intimate moments of our lives, like birth and death, are kind of isolated. They are like closed into hospital departments or wards. Do you think that's also part of the problem, that we lost connections to those beginning and end of life?
I think so. I mean, what I'm struck by is, for many people, there's a sense of a disconnection from the meaning of life, or they will have these memorable salient experiences, birth, not their own birth, but often the birth of one of their first daughter or son, marriage, the death of a loved one, career achievements, or there's brief moments that are salient in memory, but often not as meaningful as it could be. And I think that psychedelic medicine can help us reconnect with a sense of the meaning of life and our own effort to be more purposeful in what we are doing here, which is also part of the great mystery that we exist at all, that we're here.
So Viktor Frankl said that we should give meaning to our lives, but can we also give meaning to our death?
That's very well said. You're absolutely right. And really honoring Viktor Frankl, I've used a lot of his work, meaning-centered therapy, which is very helpful for people who have a cancer diagnosis, is inspired by Viktor Frankl. And the very profound invitation Viktor Frankl offered was from his own experience at Auschwitz and Birkenau. And if you try to fathom that for him, and for so many people, everything has been obliterated. There's no home to return to. There's no family to return to. They've all been murdered. He wakes up every morning without enough food or water in a concentration camp where his death could be imminent, where people are dying and being killed all around him, where he can smell people being incinerated. And that is the world he breathes into every single day, and remembering that even in the midst of the most hellish circumstances human beings can create for one another, here I am now, and I have the freedom to choose the attitude with which I move forward in my day. And so remembering that you get to choose when everything is taken away, when there's no control, when death is imminent everywhere all around. Nonetheless, here I am now, and I can choose the attitude with which I experience this, and that this will come and go too. Incredibly profound, and also very pragmatic and very true. It's very true in any circumstance, however unfavorable, however ghastly, we get to choose how we respond. And that's the great teaching of Viktor Frankl through his own experience, and incredibly helpful for my oncology patients to continue to remember that again and again and again, and a wonderful way to inspire life.
My favorite quote from Viktor Frankl is that you are asking life to give its meaning to you, but life is asking you the same question.
That's perfect. That's great.
So if you'd like to translate all this to like how psychedelics can facilitate this meaning-giving process, how would you explain that?
Well, part of what I would offer when we think of psychedelics, it's very important to accept that depending on how they're taken, they can be very kind of non-specific and unpredictable in their effect. So it's not in the drug itself only. It is the intention of the person, it's their sense of safety, the therapist or other people surrounding them who attend to everything in the outer world, everything outside of them, so they can go more and more deeply into the present moment. It's in life, it's in the present moment that we find, that we encounter the mystical experience. So to breathe, to go more deeply inward, to be present again and again, not to be distracted by whatever's happening outside of the self, And very importantly, whatever manifests within the mind is only a manifestation of one's own mind. So however horrific, terrifying, obliterating, welcome it all. And it's with that ethos or that intention again and again that then the person quite naturally, the self disintegrates, falls away, the whole story that the person was so attached to, they thought that was all they were, that falls away, that's gone. The physical body, they're disconnected, they're here, but at the same time, they're in some other galaxy, wondering how they'll ever find their way home. And so these experiences include the self, but are infinite in their aspect beyond the very limited self-concept. And so with those experiences, then when one returns to, in a few hours, okay, I'm back. And then, wow, all those thoughts in my mind, they're just thoughts. And how utterly vast the universe is. And how am I being in terms of authenticity to myself, integrity, and with others? A sense of connection, a sense of what needs to change, what a person needs to take responsibility for in their lives very clearly. And when there's that sense of deep connection, it's realizing that to be true, that everything is consciousness, ultimately. And so, of course, one is more compassionate, not only towards oneself, but to others. It makes very clear sense. That's what is. And with that, then what I've seen, for example, the Netflix series, I don't know if you're familiar with Michael Pollan's. Yeah, one of the women we cared for who participated in that program was a 78-year-old woman who was very, very depressed and just had never taken a psychedelic, but needed, so anguished, so stricken, that she just was open to whatever would help. And for her, that same garden, which she looked out on in the morning with her lymphedema and her pain and her depression and her sense of moroseness, her anger at life, and there's the garden, and she doesn't feel like even going out into her garden. After the experience, that garden is an aspect of consciousness, and so is she. And there's the fox that comes through, and she can feed the fox, she can feed the birds, she can create habitat for them, food for them. The snowdrops that come up in the spring are so powerful, they punch right through all that snow and ice, the first life in plant form coming into form in the spring. And so the same life situation, but the eyes to see it and a heartfelt, loving engagement with it. Now she's in relationship with the world around her in a very personally meaningful, reciprocal, and beneficial way. And from a physician perspective, now she's exercising. She's actually pushing through that initial pain from her lymphedema, and she is working in the garden and doing things that are really meaningful for her. And so all that came from within her. And when we think of the outcomes, what has changed is not only her perception, but also her behavior, her motivation to exercise, to do things, to travel, to enjoy life more. And so then the mystical type experience occasions these self-sustaining behavior changes because the person experiences themselves and the world much more deeply and appreciatively, and it's clear to them. And I think that's part of the beauty of these psychedelics, is that's a real possibility for many people. I mean, so much horror in the world happening even now, and yet also the possibility of enjoying, appreciating life in spite of all the injustice, all the unfairness, everything else. And when we think of Viktor Frankl, very importantly, each one of us in our individuality, in each moment, we get to choose what we're going to do, what we bring into the world. And so I think that psychedelics also help potentially in people really remembering experientially that it is true that we're all interconnected. And so consequently, really a personal motivation for many people to be more generous, more honest, more kind towards others.
So when you are doing scientific studies, can you measure that, like that people are more grateful in the end of their life after the psychedelic experience?
We absolutely can. And very importantly, not only what's called self-report, meaning the person's subjectivity and how they respond to a questionnaire, but we also get permissions to talk to their husband or their close friend or brother or sister over time. Do they see change? So we want to really get other people to let us know, has anything shifted at all? And that is also the case that very often spouses are really grateful because now their wife is much lighter, less preoccupied with death, less difficult to be around, and wanting to travel, wanting to make the best of life as it is, even though there may be some real limitations. And so it also has a kind of a reverberating effect on others close to the person and perhaps more remotely. And so I guess I think that it's wonderful for me to see that, and also as a clinical psychologist to know that I now have ways I can be helpful to people in an incredibly profound way. It will happen within them, but I can help create a context, and we can offer these medicines, and that will be safe, and there's a greater probability that person will live their lives much more deeply, much more appreciatively. And if I can help with that as a healthcare provider, there's nothing more important than that. There's no intervention that could be greater than that. So even if my role is peripheral and I'm a support, I'm a kind of therapist in that context, if I can help a person have their own experience of what we call a mystical experience and help them fathom what that means and what they're going to do with that experience, how it was hard, whether there's things that they're deeply shaken by that they need to really work through, and what are the resources that will be useful to them so they can meaningfully integrate the experience and then be more present here and now in their lives a year from now, 10 years from now. Then the discipline of clinical psychology, psychiatry is powerfully useful with those tools and that depth of knowledge and understanding.
How do you know if a patient is eligible for psychedelic treatment? Do you have any methods for screening?
Absolutely. In the current US healthcare system, part of what I'm doing now is working with a company called Gladstone. And Gladstone is a very large psychiatry and behavioral health practice, and we're now including experiential medicine. Right now, the medicine we can use is ketamine. Ketamine is an atypical psychedelic that has dissociative effects, but if it's used incisively, it absolutely can occasion mystical type experience for people that's very meaningful and lasting. And so the medicine we can use right now is effective, and soon enough, a couple of years, we'll likely be able to use MDMA, 5-methoxy-DMT, LSD psilocybin, and I'll be grateful when we can use them in clinic. Again, this is healthcare, not an academic medical center, not a clinical trial site, but working to help the general population, so all diagnoses. But we must assess them properly because there are hundreds of thousands of people who've heard about psychedelics. They have an idea it might be curative for them. They want to take it, and we need to have a process where we really determine whether this is the time for them or not at all, or if treatment would be modified to a lower dose or extended outward if there's greater complexity, and how do we inform the treatment team? We have a pathway, and so the model we've developed, we have shared with other clinics in the United States, in Australia as well, and we are hopeful that they'll utilize this. And the preliminary concept is, just like in primary care, you see a doctor and they ask for labs, and those labs inform the doctor why you might need this antibiotic as an intervention. We've taken that idea and applied it to psychiatry, and so we have what's called an advanced screening, which is very comprehensive, and beyond the severity of anxiety or depression, whether there is significant borderline personality, meaning a tendency towards psychosis, or having what's called an inchoate self-concept. People don't know who they are, and they can kind of fall to pieces and become very impulsive or acutely suicidal. The degree of paranoia, the degree of kind of self-loathing a person might experience, or their sense of self-efficacy, locus of control, whether they're demoralized, what is meaningful and purposeful. And so it's really beyond the symptoms, a picture of the self globally at this point in a person's life. I meet with the patient, we review that report. I then meet with the medical director and review that report with him, and he determines yes or no, and then we proceed with treatment. But focally, it's one document that gets in front of every provider all the way through. And so we have a pathway for clarity of information and decision making, and that has to take place for this to be helpful at scale, because we want to manage risk and what's called opacity. Opacity meaning there's something there and we don't see it, or it wasn't communicated, and then we have a suicide downstream, and now we need to take a look at what we missed. If we want to prevent those suicides, we need to prophylactically have a clinical interview that's very structured. And when I do the clinical interview, if you were a potential interested patient, I would be asking you compassionately, what are you most ashamed of? In your lifetime, what have been the most traumatic experiences? And it's a benevolent intent, because if you felt comfortable enough to speak to what that is, then we can be more helpful in understanding. And then with medicine, for a person, if their great shame arises, if their trauma becomes embodied again, it's already been discussed, it's already been spoken. And so there's safety then in the first contact, and everybody's aware, and it's very efficiently communicated. And so we create a better treatment algorithm. And so that's the hope. We're doing that right now, and the hope is other clinics will quite naturally see that as, that's a good idea. And whether they use our iteration of it or modify it, all the more power to innovation. But I want to do what I can to help us translate from Johns Hopkins and the clinical trial side to the healthcare system side, where I am now, and that's ultimately where the care will be delivered.
If you go to like palliative care events or do you speak to professionals? How is this message about psychedelics received? Is there a big interest or opposition?
There's tremendous interest, because there's such a need. The medicines that we have are ineffective or marginally effective. If somebody is demoralized, that's an existential crisis. And SSRI is probably not going to be helpful much at all. Many oncology patients are already taking so many medicines. They have so many specialists, different scans they need to take routinely, that another medicine, another healthcare provider that they need to see routinely is often really not welcomed, or may be more stressful in some ways. And so the discipline, I think palliative care, oncology, I work in an oncology center now with 50 oncologists, and there's a real appreciation that we need better treatments. And it's very promising. And how can we deliver experiential medicine safely and effectively to oncology patients? And we're working on that right now. And I think that needs to happen. There's a lot of support for it. And I would also offer that one of the key takeaways is even when it is an absolute crucible, meaning it's a hellish experience for a person, it's very hard. There's a lot of grief, there's a lot of rage, there's a lot of non-acceptance that they have to go through, enormous fear that they have to contend with. If they keep going, they'll move through it all to a deeper realization. And so I, as a therapist, might be holding their hand, reminding them to regulate their breathing, that this experience will come and go, to please put the eye shades back on and go inward again, even though it's terrifying or it's not what they want to be doing. And then the person moves through the experience and comes to a deeper understanding of themselves. And that's very, very useful for them. And it may or may not include letting go of fear of death. Not for everyone, but definitely helpful, even if it's hard.
I think that many people are afraid of psychedelics because they think that they will make things worse, even worse, or they will feel even more insecure in the end of the experience.
Well, and that can happen. And some people are very deeply shaken by their experience for many months, what's sometimes called ontological shock. Our ontology is, for each one of us, our individuality, our sense of what is the nature of reality, who are we, and if that collapses or disintegrates, then we need to rebuild or coalesce again a sense of what our understanding is now. But it's okay if it's really hard and if things aren't immediately changed and if they're even much worse for a time, because now myself, I can work with a person to really work through what is meaningful now and what do you need to let go of, what isn't helpful anymore. And so it's a continued process of growth. And so I really think that when I talk with patients to prepare them and to help them make a decision if they want to consider experiential medicine or not, I emphasize that if it's absolutely excruciating, that may be very helpful. And not to welcome it, that's hard to do, but to accept. Just like a surgical procedure can be absolutely excruciating and also life-saving, and or demonstrably increase a person's quality of life. And so if there's inescapable pain, if you are confident that there's the possibility on the other side of that pain, inner peace, or greater acceptance, or less pain, then it's worth the risk. It's worth the commitment. And so I let people know that there's a lot that can be learned from really hard experiences. And that's certainly true for me in my life. And I also hope to convey my intention to be supportive of the person, whatever the experience is. I'm there with them through that experience to the other side of it. And whatever happens afterwards, I'm available to continue to unpack or work through that. And I think that that's helpful for many people then to think a little differently and be more curious, more open to whatever manifests in their mind, whatever it is.
And one last question, how do you see the future? Will this become mainstream form of treatment in like a few years, or how much should we wait for that?
Well, that's my intention. If I'm going to contribute to the field, I hope to really innovate with Gladstone, meaning that we offer TMS and DBT and weight management and experiential medicine with ketamine. And we're really committed to delivering great quality of care that's covered by insurance, that's accessible, and very disciplined, our team. And we really are learning, we're consulting with one another, we're continuing to evolve our understanding. But if we think of that as simply one healthcare system, multiply that by 10,000 nationally, and if there's, and again, that idea of SABA that I spoke to earlier, if there's an information network that is evolving constantly, that can train everyone or update everyone in these systems, then that idea of the patient who is suffering, and there are these different treatment options. One of them is experiential medicine. Okay, I'll try that. They try that, there's a positive outcome, but they've also had a profound experience of an expanded state, meaning beyond the self-concept, infinitely more than that is also real. And now they come back to their everyday life, but they've had this remarkably profound experience, whether it was challenging or not. And then you think of millions of people having an expanded state of consciousness that is safe and supported and recommended by their doctor with a bunch of healthcare professionals who are trained and accountable at massive scale, then that can be a tipping point culturally for millions of people to begin to experience themselves, the world, the universe very differently. And the elegance of it is how often I hear that it's not what I think, it's what they experience, and now they're more connected with all of life because they remember they're always a part of all of life, consciousness, etc. And so then there's an internal motivation to want to connect, want to contribute something, and that continues to happen naturally for many people. And so I'm certainly committed to whatever I can do to be of aid as a catalyst to help move this process forward, to also share a lot of what I'm learning, this understanding with others, so they can avoid some of the mistakes and take this knowledge and continue to build on it. And for that to be a global platform, translatable into any language worldwide with a few limitations. So nations that have absolutely no infrastructure, now they do. And those nursing programs, social work programs, they have some tools to begin to build immediately. And so that's where we're at right now with SABA. And that's very promising because that's absolutely prerequisite to worldwide accessibility of psychedelic medicine.
So welcome to the psychedelic future, right?
We're here now.
Thank you so much.
I'm really honored. Thank you so much.